And this is different than anything, any clinic around.
Workouts that are tailored for her, and that really makes a difference.
Really personal. I've gotten way more mobile, stronger, flexible. Just everything just improves me to the next level.
Welcome to the On Cue Performance Therapy Podcast, where we push sports performance and physical therapy to its apex. We change the game by bringing together the brightest minds in the field to offer best practices and question how things are done today. I'm your host, Mike Quintans, physical therapist and expert in sports orthopedics. I'm living my dream and opened a clinic that unites all elements of sports medicine under one roof to drive recovery and performance outcomes. What's happening, Performance Therapy Nation? This is Mike Quintans, your host of the On Cue Performance Therapy Podcast. I'm joined today by Dr. Brandon Eck, Doctor of Osteopathic Medicine, specializing in sports medicine, as well as osteopathic manipulative techniques. He is passionate about sports and has a sweet spot in his heart for cycling. We dive into stress, osteopathic medicine, chronic stress injuries, PEDs in cycling, and dream clinics. Today, we will be covering a multitude of different topics, including those I just mentioned. But first, I want to thank our listeners for showing the On Cue Performance Therapy Podcast some love by subscribing and leaving 5-star reviews. Shout out to Nick, who wrote super informative podcast with some brilliant guests. The host brings a great energy to the podcast. Can't get enough of how exciting this podcast is. Dr. Eck ran the 800-meter event at Villanova, graduating with a BS in biology. He then went on to complete a family medicine residency at PCOM, the Philadelphia College of Osteopathic Medicine, followed by a sports medicine fellowship at Virginia Tech University, where he went on to serve as the assistant team physician at Virginia Tech and Radford University, as well as the Pulaski Yankees minor league organization. He's an avid runner, cyclist, and rower, as well as an Eagle Scout. What's going on, Doc? How you doing?
I'm doing well, thank you very much.
This is really cool to have you on. We've talked about this a while now.
It's been going on months.
Months. All right, and you didn't show up empty-handed.
I did not.
Which is pretty cool. So thanks for bringing the pies.
Always got to bring the fun.
Yeah, because we're going to talk a lot about health.
Absolutely, absolutely.
So I want to dive right into this. This is sweet that we're doing this. You look fabulous as always. Let's dive into it. So your educational background, you grew up State College area. So tell me what it's like growing up there and where you're at now. Connect the dots.
Well, for me, I think growing up in State College, Pennsylvania, for people that may not know, that's the home of Penn State University. I have two brothers. Both of my parents worked at the university. One is a physical therapist, the other's an athletic trainer. So pretty on point for an upbringing for a sports medicine physician.
That's why we get along so well, I think.
That's probably why we do. At least I understand what your role is, and I hope you understand what my role is.
I try my best.
But growing up, I spent a lot of time around sports. I mean, my dad covered basketball, baseball, swimming, women's ice hockey, volleyball, both men's and women's. And my mom was working with the general student body.
And this was for what school?
Penn State.
All for Penn State. That's awesome. So you grew up around Penn State athletics.
Yep.
That's sweet. Like you were sideline passes.
For most sports, yeah.
Right.
Absolutely.
That's awesome. Up until like what age?
Until I went to Villanova.
That is awesome. I don't know if we've ever talked about that. Like obviously Virginia Tech, we've talked about that, but to be on the sideline with your parents, like running onto the field, or your father running onto the field if someone were to get hurt or what have you, or have that much of a role.
It wasn't
pretty sweet.
It wasn't that glamorous. I mean, it was a lot of fun, and it was really cool for me because I got to see a totally different side of sports. But I can remember I'd go on with trips with my dad to baseball games in Indiana, and I'd go kick dirt behind the dugout because I was bored and I didn't want to watch baseball when I was 8 years old. But with basketball, we'd sit in the front row and watch Penn State play, some of the bigger games of the year. And one of my favorite memories is we would, for a couple years in the 90s, Penn State made the NIT, and we had a hotel room looking out over Times Square, and my brothers and I would just watch the straw go in and out of the Coke bottle. And then we would go to the games, and they were like 9, 10, 11 o'clock at night, and we'd pass out in the seats because we were so tired from,
State
New
college.
York.
You're from State College, like respectfully. And I don't mean that as a
Right.
knock. I'm a Delco kid, so I'm not talking trash here. But like to have a hotel overlooking
Yeah.
Times Square, like I would get like a googly eyed over that. That's awesome.
I mean, it's like a dream. It still feels like a dream to me because it was so long ago, but at the same time, it was a really cool experience to be able to remember. But then watching great basketball, I think again was a really cool, experience, and getting to know, I should say, the athletes. And I remember going to volleyball games when I was a little older, and I'd see football players in the stands watching, their friends on the volleyball team.
You knew who they were,
and I knew who they were, and I knew, I knew the female athletes, I knew the male athletes. So, but again, because of their stature, and their high level of athleticism, and again, what they were doing on the field, especially every Saturday for a football team, you see them in the flesh, and it's like, oh my gosh, these guys are heroes, so to speak.
And they're right next to you, and Dad takes care of them.
Exactly.
If they get banged up,
But it's the real people,
cool.
and again, you have that. There's a mysticism to that.
College students,
right? let alone college students.
Right.
These are people that were held to a very high level of prestige, with what they did.
So someone reached out to me recently and said, like, I need like stories, like drop a story, like not me, but like somebody, a guest. So like, give me something. Like LaVar Arrington was probably, that was 90s. I don't know if you would have been there.
Oh yeah, I was there.
Like to see LaVar Arrington. So LaVar Arrington, for some of these listeners who don't know, sorry if you don't know, was a man-child linebacker for Penn State University. He was a number 1 or number 2 pick. Him and Courtney Brown went like 2-4 that year or something crazy. Guy was a freak, and just looked like he was 10 years older than everybody else on the field. I mean, animal. So like, you've met him, you saw him.
I've met Lamar. I have met LaVar Arrington. I get my one memory with LaVar would be that his shoulders were wider than his locker was in the football locker room.
Yeah, doesn't surprise me.
But again, like I use it as an example. I remember being at a volleyball game, and Kyle Brady, one of the tight ends for Penn State football from the mid '90s,
Jets, yeah.
and Kerry Collins, people who are New York Giants fans.
Wilson High's finest.
That's right. I remember them being in the stands, and I remember going up and asking for an autograph. And at the time, I was 8 or 9 years old, and I got an autograph, which was really cool, for me. But being able to just see these guys and who they were was just a pretty incredible experience.
So did that kind of make it all, because you eventually went to Villanova, Virginia Tech? Did that make it kind of like easier for you, like to be around sports? And obviously you created affinity for sports as a result of some of these experiences. But did that make it easier for you, or like not to be like stargazed? You know what I mean?
Yeah, I would say that it did and it didn't. I think in the role as a team physician, you have a totally different relationship with an athlete versus a fan or an athletic trainer, so to speak. And I think that it helped give me a foundation. But in a year fellowship, it's still an interesting relationship that you have to navigate, because you're going to have you may have a personal relationship, with these individuals, but there's also a professional relationship that you're also going to have. And so you have to, how do you balance those two things out? And, for a lot of things, I would go through the athletic training staff to, deliver news or information, or they would be present in the room during the encounters. Let's say we're reviewing an MRI for an athlete, or it's, we'd have a roundtable discussion with the staff, be like, okay, well, what are we going to do with so-and-so? How are we going to handle this injury? What's the next step? And there is, at least from my experience at Virginia Tech, it was a very team-based approach to the medical care for the athletes. And also that the athlete had, a say in that as well. But I think that a lot of what I do in an office is, obviously it's directed solely by me as the physician and the patient, having a discussion. But in that environment, and certainly I think that this would also hold true at the professional level. It's a team-based a discussion and approach that involves the athlete and what the best decision may be, whether that's to be more aggressive, offering surgical options, or to be conservative and say no, physical therapy, or just doing an injection may be like the reasonable thing to do.
It's interesting you bring up the team approach to making the best decision or helping that individual, whether it's an athlete or a patient, make the best decision.
Yeah, again, I think it's really important. I think that a lot of times what I'll hear from patients is that, Doc, you're the expert. I want you to make the decision for me, which is a pretty big decision to have to make on your own. And I can rely on my professional experience, and I can rely on what I would consider doing in this situation, but based on the patient's information. But at the end of the day, the only person that knows their body the best would be the patient. And I think that we need to, as healthcare providers, we need to make sure that the patients are empowered to make their own decisions and ask the questions and be able to direct the care in a way that they are on board with.
I think that's one thing that gravitated, at least me, towards you as a physician and me being a PT, is that you seem like very focused on like what is best for that individual. And we know the reality of the whole thing. We don't have to dive too deep into this, but the reality is there's networks, and the networks want you to keep within the networks regardless of what is in the best interest of the patient. And I think what gravitated me towards you was that like you care. Like you really do care. Like you treat every single one of your patients like they were your sibling or your mother, your father. That's special, man.
Thank you. I appreciate that.
Yeah, so I want to get into so Villanova was, high school. You ran track at high school.
I played football in the fall, and again, growing up in State College, what does most boys want to do? They want to play for Penn State football, or they want to go big time, whatever you want to say. And so that was my goal growing up. I wanted to play Penn State football, and then I got into my senior year. We had made the semifinals of the year before. When I was a junior, I got to play a little bit, which was a great opportunity as a junior. I mean, I certainly wasn't a starter, but I was playing a pretty good amount. And then when my senior year came, we got a new coach, new offense. It ended up being, instead of being a spread option offense, it was a wing T option. So
complete opposite.
Complete opposite. I was a wide receiver. I played cornerback. I started on defense, but I just lost the love of the game just because I think that there was a lot of things that kind of went into that.
Sure. It's tough to get comfortable too. Everything
Exactly.
just flip-flopped on you. I mean, even the lifting program and little things, I would even think that plays such a big deal in your day-to-day role.
And I think that and I would tell you that I had a really good foundation, and I had a really good strength and conditioning coach, so to speak. And, most of it was self-driven, in that era. But when we had a formal program, I actually honestly think it went backwards, because in that environment, it was actually it wasn't prepared for that. It would happen, tried to happen too quickly. And what happened, I think overall was good, but for the juniors and the seniors at that time, it was really difficult transition because it happened so quickly.
Especially where you guys were before that, right? I mean,
Right.
You said you were in the semis.
Yeah, we made the semifinals of the states.
From semis to complete flip, and there's a learning curve to that.
Right. Now, I think it, the diamond in the rough, so to speak, is that I was probably a better runner, and I feel fortunate that I had the strength background that I got from football, but being able to translate it onto the track was night and day difference.
If you were to have a son, would you let that son play football?
That's a good question, and I don't know.
I find that this is the toughest question for anyone who has played football, I think, to answer. If you played football and you understand everything that you gather from football, what's so great about playing football? Go ahead. What do you, as a human being, what are you proud of that you played football? What did you take? What was your takeaways?
I would say being part of a team, being able to execute a play and score a touchdown. Like, there's nothing more thrilling than being able to, move the ball as a unit and score a touchdown. But at the same time, being on defense, being able to hit a kid as hard as you can.
You're smirking. Look at this big old smirk he's got. Yeah.
It not inflict pain or anything like
gotcha.
that, but again, it's from, I guess an ancestral, primitive instinct to be able to show strength is it is what it is.
I agree with every single piece of that. When you bring, at least where I grew up in Delaware County, you have walks of life, like all walks of life playing together. Skinny kids, fat kids, right? Heavier kids, white kids, black kids, Asian kids, like that doesn't matter. All cultures coming together for one common goal, and there's accountability.
Yeah.
Like if you screwed up a play or you fumbled the ball or you, what your action resulted in a poor result for the team, there was accountability, and that's special. Like, where else do you get that? You know what I mean? And like the time we spent in the locker room, and it's not like 3, 4, 5 guys. We're talking like 90 guys on some of these teams.
Absolutely.
So like to me, that was special. The kid who I depended on for me not to get hurt or for me to bust my butt to block for, maybe I didn't talk to in the hallway, or maybe I didn't. I wouldn't have known him from anybody else if I didn't play football. But like for those like hours every day. Like we sweat together, we depended on one another. Like you don't get that anywhere else. So how do you take that away, or how do you replace that for your son or daughter?
I mean, you have to just look at the other sports, and you have to kind of weigh, what the benefits of them may be, as well as, what they love. I mean, again, I think ultimately, if my son or daughter decided that they wanted to play football, then I think that I would want to support them in that decision. But let's say, but as a parent, I might say, okay, well, I'm going to steer them in another direction. Or I think that what you see very commonly is parents are like, I want my son to be, a professional football player, baseball player, basketball player, whatever, and they steer them in that direction. Well, what I would say is I want my kid to play every sport under the sun, figure out what they want to do and what they're most passionate about. And I actually am a believer in the late specialization. Like if you read any literature or you look at any studies about what sports did professional athletes play when they were growing up, and the answer is most likely that they played a variety of sports.
This is true. What was the first round of the NFL draft this past year? I think I forget 20 of the 30 picks played 3 sports in high school.
Yeah.
And around here, at least I can only speak for this area, everyone specializes. It's more common than not that you played the same sport. Now, you're talking about late specialization, which is maybe somewhat beneficial, but like specializing in something later. But the more you can be exposed to throughout your youth, the better. Why not?
I think, and the one example I would make is one of my teammates in college, who ended up getting 6th at NCAAs in the 800 meters in 2009. He played soccer until his junior year in high school, and then committed to running track, and then was running in the low 150s as a high school senior. And they won multiple races on the national level, and was able to get a scholarship to go to Villanova. And yes, soccer is a great sport for developing endurance. But there's a lot of other things you spend time doing, hand-eye coordination, foot coordination, skills development. And he wasn't just running. So, again, I think that's evidence enough in and of itself. And now, again, track and cross country is a more specialized sport in and of itself. But, you can do almost any sport and be able to get better at running. Sure,
without a doubt. There's something to be said for not playing the same sport all year round and what that does for repetitive injuries. Mm-hmm. I mean, it's fascinating. Like Tommy Johns used to happen to the 35-year-old. We're going back like 70s, 80s, not even 90s. That just was like wear and tear, right? Just beat up. Now we're seeing 12, 13-year-olds with it. And it's not because they're throwing harder than those 35-year-olds were. It's because that's all they do. And it happens more in the South than it does in the North. And it's because they can do it all year round. Right? I mean, we're seeing it in this area now. We can dive into that, but that's the repetitive use and the early specialization go hand in hand.
And I think that kind of brings us to, discussion about stress. Okay. I think that, in anything that you do in life, again, there's a fine line between what's enough and what's too much. And for what I do as a sports medicine physician, I don't just deal with athletes, but any type of work or any type of individual, whether they're an athlete or not, we do a lot of the same things on a day in and day out. And whether that's sitting at a desk, whether that's picking up bricks as a mason, laying joists or floorboards or roofing.
All things you have to look into to see how those movements are affecting that individual in front of you and how that correlates to their pain.
Right. And so, you think about stress, whether it's physical, it's mental, you think about it as a circle, okay? And that circle needs to be completed for the body to recover to a point so it's prepared for another load of stress. And again, stress can be anything, whether that's lifting weights in the gym, it's going for a 5-mile run, it's walking around the block, it's another day at the office for 8 hours. And what you do on a regular basis, whether that is, again, training for a specific goal, let's say to be an NFL linebacker, or again to sit at a desk and type all day, or be a high school 800-meter runner, tennis player, golf, whatever.
Stress is going to impact each of them differently.
Right, and again, there's different types of stress. So again,
Sure.
that's important that we get a balance of load, and over time, as you train more and more and more, you're going to get better and better at handling more load or more repetitions, to the point where you're not stressing the tissue to the point of failure, but to the point where it's going to get stronger. And if you let that process go awry by doing too many repetitions, let's say as a pitcher in a little league, too many repetitions of doing a bench press, or too many miles running out on a trail, over time that's going to actually lead to degeneration of a bone or a tendon or a ligament, and that's going to land somebody in my office.
So stress is, I say this sometimes, strain versus gain, right? Strain,
Yeah,
how much
absolutely.
stress is appropriate, where it results in a strain, or too much stress would result in a strain. The appropriate amount of stress would result in a gain,
Exactly.
right? So a
Exactly.
benefit and improvement. So I'm with it, 110%.
So, and then the other thing that a lot of people don't think about is that, or don't talk about even, is, there's mental stress, there's nutritional stress, there's sleep stress, there's a number of different ways you can attack stress reduction, okay? So, you think about the dinner we're having tonight, it's, pizza from down the street, some chicken wings, not the best nutritional, contents for an athlete that's trying to promote, healing and for growth or gains. But you have to, again, you have to balance that with, all the healthy decisions you make. And that's where it really impacts, an injury. Okay. You talk about an injury like, a tendonitis. Okay. There's a lot of things that you might have a lot more leeway, with recovery, whereas a concussion, okay, you have to dial in every single component of this recovery process because it affects so many different systems. You have to be making sure you're getting your sleep. You got to eat right. You got to drink lots of water. You got to push your body, nudge your body just a little bit to get your heart rate up, to get your blood flowing, but not enough that you're going to create symptoms.
The brain doesn't turn off. You can shut down a tissue. Maybe you don't put weight through it, or maybe you don't use it. You can't shut the brain down. Right. So, amen. That makes perfect sense to me. So let's be clear here for some of our listeners. Stress can be amount of load on a tissue, right? That's a stress. How much a tissue, meaning a muscle, a tendon, a ligament, so forth, bone, can tolerate in terms of workload. But you're also talking about stress in terms of your diet, right? What stress is appropriate for that individual who's competing in a triathlon tomorrow, right? Like what like dietary stress or mental stress is going on in their lives, whether they're dealing with some kind of emotional issue at home or some more sensitive issues or what have you.
Or, I mean, you even use the example of what's going on right now with the whole COVID virus and the stress of having to do online learning.
Absolutely, all kinds of stress there.
Right, and again, I think that there's macro choices and there's micro choices, and even on a daily basis, if you're eating healthier on a regular basis, you're gonna feel better. You're gonna have better workouts. You're gonna be more productive at work. You might be a better husband or wife or brother or sister, whatever. But again, it's there's a give and a take. It's balance.
That's exactly right. I mean, it's balance. So I noticed this. I'd done a cleanse with a friend of ours, Dr. Lake and Greg Masico. So I did this cleanse, and the cleanse pretty much focused on like not eating, pretty much like no dairy products, no sugar products, so including even fruit. So it was like almonds a couple times a day, a ton of water, and then a vegetable and a protein at lunch and a protein shake at dinner. And listen, I'm not saying I agree with that dietary approach, but I did it for like 3-4 days, and the first couple days sucked. But after that, like I felt like so much more clear. Like I felt like I could focus differently, and that affected me mentally. I forced myself to go to bed early so I wouldn't want to eat later at night. So like again, like so it all kind of intertwines, right. And you're going to see results physically, mentally, and so forth.
And then you talk about, let's talk about life changes. I know you're going to have a big life change coming up. You're about to have a new baby. That's a huge stress. And now you're no longer worried about just your own health, but the health of your child, and your work. Okay. So, you're introducing all of these different things, and, for parents out there, or kids are going away to college. Again, these are all big changes that you're going to have to make in your life, and you're going to be making new decisions, and you're going to have new stress on your plate that you're going to have to step up and manage.
So let's apply this. I mean, and this is great conversation because athletes don't hear this kind of stuff enough. We think like athletes in general think, all right, I got to do A and B and I'll get C. But there's so much involved with that. And I think this is important for the coaches, for the parents, for the physical therapists, for the medical professionals. That let's take a break and pause. Social and emotional learning, like all that whole entire concept of what's this individual in front of me going through? Do they want to participate this weekend in that dance or that performance or whatever it may be, that event? Like, yes, they're injured. They want to get back in time. Maybe they do. Maybe they don't. Maybe mom and dad are the ones really pushing it. Like, are we separating them from their parents and maybe asking the kids questions and not letting the parents answer? And not kids. That could be a 10-year-old. It could be a 20. It could be an 18-year-old, 17-year-old. So we have to, I can't stress that enough. There are times where I've asked a patient, meaning a child, an adolescent who's 14, 15 years old, and I ask them a question. Mom answers. And I don't even acknowledge mom. Like, with all due respect, mom, sorry, I'm not even going to look at you. I'll ask the question again. And, hopefully she gets a hint. Like, I'm not asking you how, they slept last night.
Yeah, absolutely.
They can tell me that.
And there's, I remember when I was in my training, we learned a little bit about how to disengage an individual from that from that environment. Getting the kid into the office by themselves.
That's awesome that you guys do that.
And getting a chance to talk to them about just life stuff, because again, I did primary care training, so this is about simple things: nutrition, sleep, school stress. You're going through puberty. What changes are going on in your body? Managing blood pressure, diabetes. All the standard health problems that a lot of people have. And we can have those conversations about that kind of stuff. Now, I don't necessarily do as much of that on a regular basis, but I still deal with diabetics. I still deal with patients with blood pressure. So, but more importantly, from our patients with kids or who are under the age of 18. It's harder to have a conversation with them without the bias of mom and dad. But again, it's important to have mom and dad there, but stealing those couple extra seconds to have that conversation is difficult.
And I've done this plenty of times. I've educated the parents. Like, your daughter's going through an ACL injury right now.
Yeah.
Like, she's going to go to a college to play soccer. Like we have to stop and really think, what is she going through?
Yeah.
Like emotionally, what is she going through? Like her identity is completely changed right now.
Mhm.
So like, let's tap into that for a second, take a deep breath, and let's not worry about, is she running 3 miles or 4 miles this weekend? Like, let's just, maybe she's going through some other stuff right now, and we need to tune into that.
Yeah.
And not just worry about X's and O's and tackling and blocking and everything else. Like, can we be sensitive for a little bit?
Absolutely. I mean, and the other issue is that everything is so immediate these days. Your son or daughter gets hurt, they go to urgent care, they get an X-ray, everything looks cool, or looks good. But they're still in a lot of pain, and they want an answer immediately. Shoulder pain. I don't exactly know what's going on yet, but they still want an answer.
It's okay to say that.
And it's okay, but then it's
Good for you.
when do I follow up with them? Can I squeeze them in 2 or 3 days later? Do I have to send them to another doctor? Again, there's a lot of things that have to go into that discussion about what to do with the athlete, and this happens at multiple levels. Certainly at the high school level, and a lot of times I think if you don't have an answer for somebody, they're going to go somewhere else and they're going to try to find that answer.
I see it all the time. We're going to get another opinion. Okay, what are you expecting to get out of that opinion? Well, we're hoping to get some different answers. An answer that you want, or are you not satisfied with the answer that you already got? Tell me what the problem is. I want to know. What do you want to get out of this? And the kids are along for the ride,
Right.
more often than not. I feel like this is a bash parents episode, but I think it's an opportunity for parents to reflect, coaches to reflect, medical professionals to reflect. ATCs, PTs, physicians, all the above that deal with athletes, especially athletes and kids in general, to reflect on how are we handling these situations.
But I think that and I can say this as not being a parent. They're coming from the idea that I want to do everything that's possible to make sure that my kid is healthy and doesn't have an issue for the rest of his life. And I need to know the answer. I want to know the answer. And there's nothing wrong with me telling a kid that you have knee pain, I think you sprained a ligament, and them saying, okay, well, we want a second opinion, and they go see a knee specialist, okay? You go see a surgeon, depending on what the injury is, they may tell you, I don't know, but I'm recommending surgery, or this is the problem, and I want to do surgery.
It all comes down to trust. My last episode, we spoke about this so much. It all comes down to trust. If you're genuine in your answer and you're able to support, hey, I'm pretty sure it's this. Here are the reasons I can't completely diagnose an MCL tear because I don't have MRI vision, right? I only have an X-ray here, and we're going to order an MRI and see what's going on. But I can tell from this valgus testing that there is some gapping there, and this is a grade 2, I believe. Okay, you supported it, right? It comes down to trust. Are you able to use your words appropriately to make that individual, especially the parent, and their son or daughter feel comfortable with what your diagnosis is? And that's okay. We'll get the MRI, and then we'll go from there.
And I think that the relationship of a school with its athletic training staff, if they have it, I think that's really important. And I think that parents should do the due diligence to know who the trainer is. If my kid gets hurt, who are they going to see initially? Okay. And then where am I going to take my child if I think they have a knee injury or a shoulder injury or it's a hand injury? Am I going to see the doctor that the trainer recommends? Am I going to go to urgent care where I'm probably not going to see an orthopedic specialist? Or do I take them to the orthopedic urgent care where I may see a sports doc or a surgeon or even just a PA? Again, you got to think about those things. And I think that as a parent, it would be important for you to have done your homework to know, who may see my child and who may I talk to, or if it's an acute injury, at least waiting a few days to kind of let things settle out and to get a better idea of what may actually be going on, because it may just be crying wolf.
So you've had the fortunate experiences of being the assistant team physician at Virginia Tech University, as well as Radford University, and high schools in the greater Philadelphia area as well, and in Williamson College.
Yeah.
So I'm dying to know, because my parents in high school and in college never met with the athletic trainer once at the beginning of the season, right? Or even the team physician at the beginning of the season. So in high school, we went where we wanted to go. I don't remember Sue Moffitt, for example, over at Williamson, name dropping. She's awesome, aces. Did everything I could not to see her. My senior year, she was really good. That's why. I don't remember her making a recommendation to see somebody, and I'm sure she could explain why. But nonetheless, I'm curious your take on that. Should these athletic trainers, if they can, get the opportunity to sit down with the parents or meet with the parents during preseason, especially in high school, I would think.
Yeah, I mean, again, I think when I was in my fellowship training, it was expected of me to go to the high school that I was going to be covering for the year, and I went to a parent athlete, meeting at the beginning of the season. That all the coaches got introduced, I got introduced, and fortunately I had a really good relationship with the athletic trainer of the high school, who also worked in the clinic that I was seeing patients in, and so he would talk to me daily about injuries or people that were going on. Now there were certainly a lot of athletes that fell through the cracks, and there was a kid that dislocated his elbow during a wrestling tournament from the high school that I covered, and I never heard from him after I stabilized his elbow and sent him to the emergency room. I don't know what happened to him. I really don't know what happened to him.
Yeah,
now again, that's a surgical,
Sure.
Maybe a surgical issue, but as far as I know, he didn't even follow up with the athletic trainer.
Yeah, and I think if there's a conversation at the beginning of the year between you and the athletic trainer together in front of the parents, and again, this is all hypothetical here, and that's a lot of what we do here. Like, let's hypothetically, what's the perfect situation? And we realize, before I even get into it, it's never going to be perfect.
Right.
But if you and the athletic trainer present yourselves in front of all the parents and say, listen, in case of an injury, this is our plan, right? But, we'll take care of everything on the field, on the mat, on the court, or what have you. And then we'll get them into the office. You'll make the best recommendation you can make based on the data you have in front of you, whether it's a surgical consult. You know the best surgeon. I'm going to send you to the right, man or woman for that, and so forth. Maybe it's physical therapy. Maybe it's rest. Maybe it's whatever else it may be. Maybe it's an MRI or X-ray. But that trust, when you tell the parent that, as a team, you and the trainer together, it's not, oh, my Johnny's hurt. Now we got to find, what do we do? How do we get him better? You send him to the urgent care or to the ER, and then what? And they're like, oh, I guess what do we do now? If you had that conversation at the beginning of the year, maybe they would say, okay, let's call Dr. Eck up. Maybe he knows who we should talk to. Again, in a perfect world.
In a perfect world.
Yeah. Thoughts on that? Do you feel like that would be cool to do something
No,
like
absolutely. And again, I think the best referrals that I get are from other patients. So, again, if you have a kid or son or daughter, and your neighbor, sends patients to, a particular surgeon or another doctor, and you get that recommendation from that doctor, again, I think, or from that parent, I think that's a reasonable thing to do, is to go seek out that physician, or that specialist therapist, whatever they may do. But, again, I think that it's important to have a network, and it's important to have those relationships, and to be educated and to understand how the process may work. And for a lot of people, they may not understand how it works,
or care how it works.
I actually think that is the minority. I think most
I
people,
agree.
majority of parents, really do care, and they really do make what they believe to be the best decisions. In most cases, they are the best decision. But the business of medicine has made it very complicated for a lot of these things to happen.
So tell me about your business of medicine. What do you do? I know what you do. I want you to share with our listeners. What do you do in the clinic? What are your techniques that you perform and offer?
So again, I'm a traditionally trained sports medicine physician. I do concussion management. I do general sports medicine management, athletic, non-athletic injuries, so joint pain, tendons, ligaments, neck pain, back pain, you name it, I can basically see it, nerve injuries. And then, I have special training in ultrasound-guided injections, so, whether it's a joint injection, whether it's a tendon injection, and all the different things that you can inject, whether that's doing a regular steroid injection, whether that's doing regenerative medicine, or doing prolotherapy. Those are all things that, that I can offer. And then specifically, I was especially trained as an osteopath. So I went to osteopathic medical school, where I learned everything a regular MD does, but I got extra training. I got extra anatomy. I got extra hours performing and learning about the osteopathic philosophy of medicine, and then learning all the manipulative techniques that we can employ. So I have an extra tool in my tool belt, so to speak, where I can work on a patient physically with my hands to manipulate and to try to restore the qualities of a tissue to allow it to heal by itself.
I love that because I do some soft tissue techniques. I do some joint mobilization techniques, some manipulation techniques that I've learned in school, and more so really outside of school in some of my residencies, and the value in that. And when a patient walks into your office and they know that there's a good chance Dr. Eck is going to help me by using his hands today and not just look at an image, I don't know if there's a value you can put into that. What are your thoughts on that? And when did you know that you wanted to go that route of being able to use your hands in the clinical setting?
Well, I mean, I think the honest answer was I kind of stumbled into it, but very quickly I knew that this was the best way to be able to use my skills in sports medicine. And when I went to do my fellowship at Virginia College of Osteopathic Medicine, and again be a team physician for several schools, they promoted the program, from the outset, that you would be expected to use your osteopathic skills to treat the athletes, whether it's acute injury and helping them recover faster, whether it was a chronic injury, we're trying to maintain their level of relief to get them through a season, or it was to actually treat their pain. We could do all of those things, and we could do it in a conservative approach without having to get images, without having to send them to specialists, without having to worry about side effects with medication, or even doing procedures to get patients better, faster.
Sports medicine physicians have a unique skill set that allows them, correct me if I'm wrong, that allows them to perform special tests, movements, assessments to determine what is the next best step for that individual given the results of those assessments, right? Like for an example, the Ottawa test, right? Basic, right? If you're able to walk without pain, you don't need an X-ray. But if there is significant pain that's limiting your ability to walk, like you're gonna need an X-ray. Mm-hmm. But there are other assessments that you can do, special tests, I would call them, that indicate, okay, this is what you need next. You need an MRI. So you have a tool belt, or you have a tool in your tool belt that allows you to direct the patient where they should go next or what they should do next.
Absolutely. And I think, again, I have special training also with ultrasound. So again, the patient comes in, they may have gotten an X-ray. I can look at the bones. There's no fracture. But with an ultrasound, I can look at the tendons. I can look at the ligaments. I can actually directly visualize the soft tissue and say, okay, no, you have a ligament injury. This is a mild ankle sprain, or this is a moderate or grade 2 ankle sprain. This is what we're going to do to get you feeling better. Oh, again, I think this is mild. Okay, we can do some manipulation to unrestrict the ankle joint, get the lower extremity moving better, free up the blood flow, get the swelling to go down much faster, and that athlete can be back on the field within a week, or just over a week.
As opposed to we did an X-ray, fracture. There's no fracture. You're good. You can just put this little brace on and put your sneaker on and go. Or we're going to put you in a boot just because I don't know how bad the soft tissue injury is. And now that's two complete opposite modes of restriction or lack thereof. Mm-hmm. And you're guessing. When you have an ultrasound machine, and people need to know this because I didn't know this until within the last few years. Ultrasound machines, and you can give the technology much better than I can, are changing the game of sports medicine in this kind of setting. Like you can walk in and determine the severity of a hamstring injury based on the ultrasound, possibly the ultrasound, of looking at the integrity of the tissue.
Again, you can get pretty accurate with those things. And again, it takes the right training and it takes the right amount of experience to be able to, again, pick up on those things. And there's actually a wide variety of technology too. And sure. If you have a machine that is $100,000, you're going to be able to see, very fine detail, and you're going to be able to, you're going to be able to grade a muscle injury. You're going to be able to grade a ligament or a tendon issue much better than you would if you're using an outdated machine or the $30,000 machine. Now the $30,000 machines are way better than they used to be, and they're still very good at what they do. And not just for diagnostics. Again, being able to do an injection, say, into the knee joint or the ankle joint or whatever it is, and being able to visualize the needle going exactly where it is.
And you're using the machine while you're doing an injection.
And it's real. Case, right? It's real time. I literally see the needle going in. I can inject, and I can see the fluid going into whatever space I'm putting that fluid into. Again, there's no better confirmation of where I'm putting something. And for individuals that may be getting some regenerative techniques that are maybe more expensive, again, I want to be able to put it exactly where I said I was going to put it. It's not just I'm sticking it in your muscle and I'm gonna squirt it in. It's gonna go wherever.
Yeah, and you're using ultrasound without exposure to something like radiation and an X-ray or whatever else. Which
there's no radiation with this technique. Radiation. So again, it has a lot of power, and I think it's only going to become more popular. Not just in musculoskeletal injuries, but in all of medicine over the next 10, 15, 20 years.
That's awesome. You're cutting edge. Cutting edge medicine. That's pretty cool to be a part of that, and you're hungry to further that, which is pretty neat. So, PEDs, cycling. I know how passionate you are about cycling. Let's get into it. We could do a whole podcast on this. But I'm curious your take on, Lance Armstrong. We've talked about the documentary off air and so forth. Tell me about it. What are your thoughts?
I don't even know where to start. There's so much that you could talk about here, and again, I think that as somebody that does like to ride my bike on a semi-regular basis, more of this is about sport culture and the monetization of professional sports. And you take some of the most demanding or grueling events in the world. Who wants to ride over 2,000 miles in 21 days, 22 days, 6, 7 hours, 8 hours a day? And who needs help going through that? Okay. There's a reason why there's 7 or 8 guys on a team. There's the reason why there's coaches. That's why there's cars. There's officials. It takes communities to be able to support this race. But with the pressure and the amount of money that's involved in the sport, there's a lot riding on the line. Okay. And I think that I don't necessarily agree with his decisions on a personal level.
His meaning Lance Armstrong.
Yeah, or even any other cyclist that decided to use these performance-enhancing drugs. I think I can sympathize with them and what their goals were and why they chose to do it. And they were willing to sacrifice their ethics and their morals to do what they wanted to do. They certainly may regret it. They may not regret it. And I think that's clear, in Lance's case, that he has no regrets, which I don't necessarily think is a bad thing. I do not condone the use of performance-enhancing drugs, and I don't think that was the right way to pursue your goals. But again, I think that there is forces that are much greater than just one individual or a team, and unfortunately, he's being used as a scapegoat for this, and by no means is he not guilty with any of this stuff. Again, it's pretty clear from the documentary. He did all of this based on his own choice and his quest for glory.
Well said. I think there's something to be said for PEDs and competition and desire to win, glory. You mentioned that word. Interesting you mentioned that because that's the quest. That's what athletes want. They want to win. And if you train as hard as you possibly can and you can still not win, then what else is there when you know everyone else is cheating? So I get that side of it. I also I perseverate on the side of there's consequences to this.
Right.
Like, there are physical, emotional, mental consequences to using PEDs. Like, that's a fact. Like, I mean, there's been suicides and so forth. We can dive into all that. But, like, there's consequences to using these performance-enhancing drugs to get an edge. And maybe it's not to get an edge. Maybe it's to get a level playing field. I completely understand that, too. Maybe you picked the wrong sport. How do you clean that up? I mean, what do you do? Like,
but I mean, you look at what happened in baseball, with performance enhancing drugs. I mean, you have records, you have guys that were kind of brushed under the rug, or they're just not talked about in the same light. But again, I think two prolific names would be Sammy Sosa and Mark McGwire.
Not in the Hall of Fame. Did McGwire get in?
I
Barry
don't
Bonds,
recall.
I don't think so. Did he get in?
Yet.
Yeah.
No, and I agree. I don't know. Is it worth?
Roger Clemens, Rafael Palmeiro. I mean, there's a lot of names.
And there's probably a lot of other athletes that won't have to admit that they did performance enhancing drugs, and their names they're going to be glorified forever.
I think it's tough. I would also listen. I honestly think that there's probably some stuff going on now, and it's just swept under the rug.
Yeah.
If we bring it up, then it's going to face the entire sport again. How do we come back from this? Maybe we just sweep it under the rug.
But tell me a sport where there aren't performance-enhancing drugs.
You're going to push anytime. You mentioned money, and you mentioned glory, power, competition. Anytime that's up for grabs, if you can find a way to cut the corners, maybe it's sleeping in a hyperbaric chamber, which is completely illegal. Like, that's fine, right? Heck, NCAA, if you have 3 cups of coffee before competition and you get tested, you're going to test positive for caffeine. That's on the banned substance list. Excessive amounts of caffeine is on the banned substance list.
I believe it's actually like 5 to 6 cups of caffeine.
Okay, there you go. All right. Well, I'm sorry. That's why I was taking 3 to 4. Maybe that's what it was. But I guess what I go back to is athletes are going to look for any edge to compete and put their best foot forward. On the contrary, I think there are consequences to a lot of their actions, and it's tough to blame the athletes, especially when you have some of these minds that are involved. Yeah, that'll help them do that.
I mean, again, like Nike Oregon Project in track and field, you had some pretty prolific runners who medaled in the Olympics, and they did some pretty interesting things as far as bending the rules. Now they were, questionable whether they were actually still within the rules or not, but taking thyroid medication and getting therapeutic use exemptions. Again, there's a lot of questionable things that these guys were doing to gain every, quote, legal edge possible without getting caught.
How prevalent do you think that is in major sports, including the Olympics, that physicians prescribe medications that are performance-enhancing drugs? Are they allowed to use some of those medications? For example, growth hormone, human growth hormone.
I mean, that's got to be astronomically low. I mean, physicians that are involved with sports medicine, I think, is significantly low.
And you base that on anything in particular?
Just intuition.
Okay.
I mean, that was what I would say. But
Fair.
I would tell you that from a business perspective, there's probably physicians out there looking to make extra money. Sure. That would be the one way to do it. Or you're treating an individual for a non-athletic reason, and that's how they're able to get it.
Sure.
But I think most athletes that are taking performance-enhancing drugs are getting them from illegal or third-party sources. They're not going through a mainstream physician or healthcare provider to obtain those substances. Yeah,
I think we're just scratching the surface on how PEDs are used. It's one of those things where the testing is one step behind the person taking the PED,
absolutely
the performance.
I mean, you look at the Icarus documentary that I had you watch. I mean, the guy is an amateur cyclist. He wanted to participate in this race, and he wanted to see if he could do it doping. So he hired. Who
did he hire?
He hired a U.S. physician, and then that physician passed him on to somebody else in Russia, to obtain the substances and then how to figure out how to take them, in what concentrations and what doses and how often, and to periodize is what he was doing so he wasn't going to get caught.
The person that he hired in Russia, now I'm not going to get his title right, but essentially was the director of human performance for the country of Russia, for the Olympics, like appointed by like a high up like Putin or something like that.
Yeah,
and that's who he contacted to help him blood dope. I mean, this runs rabid through all of sports, and the Olympics, nonetheless. Something as pure as the Olympics.
Well, you look at simply at the WADA, the World Anti-Doping Agency. You look at the resources the United States has versus some of these other third world countries, and the third world countries have a very difficult time keeping track of athletes, keeping track of how often they're going to test these athletes, and what happens when an athlete tests positive. Again, it may, or sorry, how an athlete will take the drugs and be able to skirt a positive test much more readily than an athlete, say in the United States, where they can be tested, they can be tracked, and there's a lot of motion to help protect and help to make that a better, make athletes safer, make sports safer, and make competition more even.
Well said. I think you nailed it on the head with that last statement there. I can't even put a cap on that or a cherry on top. I think that's well said. Perfect. A lot more is going to come out about this. How much does money have to do with it, and all these other, all these other theories and stuff are going to definitely play a role. So it's interesting. I think we just have to, we got to keep our ears open and listen and see what's going on, because they're staying ahead for sure with this. All right, let's hit this real quick. Dream Clinic. You and I have spent many minutes discussing this, and I think we see it very similarly. So let's hit this real quick. I'm a physical therapist. You're a sports medicine physician. What is your dream clinic office dynamic?
My dream clinic, office dynamic would definitely be a space where I have, on-site physical therapy. I have access to 3D cameras. I have access to sensors. I have access to sport performance, maybe even a sports nutritionist or somebody that's nutritionally trained to be able to, treat or get an athlete into the office, maybe look at the tissue with the ultrasound machine, decide if they need any other imaging or whatever, offer treatment, and then be able to get that patient right over to the physical therapist or to the athletic trainer that they may be working with, to work on the mobility, work on the strength deficit that athlete has, or to mobilize a tissue that's just not moving well. Then get them over to the sports performance aspect of it, that they're then going to be able to identify what other kinematic things that are going wrong, and then work from a multimodal approach, and then have a sports nutritionist come in working on the nutritional aspect. Maybe have a network of a sleep specialist or internal medicine physician, cardiologist, whatever it would be, with a multi-specialty approach to be able to have to be able to say, okay, you're going to walk down the hall, you're going to see Mike, my physical therapist, or no, I'm going to walk down the hall and see Shelly, my cardiologist. She's going to be able to, make sure you can safely return to sport, after we clear you with these conditions. But then Mike can also strap on these sensors and say, well, you're a tennis player and your backhand is not as strong as it could be because of these 3 reasons. Okay, and then what we can do is we can tear down those issues, break them apart, and then we can put all the pieces back together and make that athlete better.
How cool! You mentioned this in the very beginning of this podcast, where you said that you would sit down with all of the professionals involved in Virginia Tech athletes' recovery and come together with a plan. How cool would that be to do that with our like clients, patients? I love that. I think
it would be great. I think it would be really good to be able to do that, and I think that that's hard for a lot of practitioners because you have to see so many people in a day, and how many phone calls can you make? how many conversations are you going to have with the therapist? And unless you're seeing the therapist on a regular basis, or you take the extra time at the end of the day or early in the morning or at lunch, those are the only times that you're really going to be able to to have those conversations.
But if you're optimizing the results, right, and you're preventing injury, like how cool would that be? I love every piece of this. You're gonna need a pretty large facility,
Yeah,
and a lot of hallways.
absolutely.
I think that's pretty sweet. You said dietitian, you said cardiologist, you said sports medicine. You gonna have a surgeon in there?
I mean, I think it would be important to have somebody in there that knows athletes and has that approach. Now again, whether that all has to be under the one roof. Now again, I don't necessarily think a cardiologist has to be, in the same office space, or the surgeon has to be in the same office space, because they're going to be treating a lot more than just the athletes. But they also need to spend time in a hospital or in a surgery or OR. So again, having easy access to those things is going to be vital, and that's why you network and you have these relationships with healthcare providers in your area.
I think the screening process gets me most excited about that. Whether it's EKGs or information you can get from some kind of cardiology exam, and I think an EKG would be somewhat appropriate while they're doing exercise, even doing a movement screening, throw sensors on them, VO2 max type testing. So let's get the data, and then let's put together a plan based on that individual's goals, not my goals, not your goals, based on what that individual wants to do.
Yeah, absolutely. I think one thing I could mention is that when I was in college, our coach made us go down to Penn, and we did VO2 max testing, and he didn't actually let us see any of the data. He kept it kind of a secret for himself, but then he knew what to base our training off of, which was really cool. And then when I was competitively rowing for a couple years, I was using lactate threshold testing when I was training. So that helped me develop an understanding of the physiological aspect of training and how important heart rate can be, how important recovery can be, and then making sure, especially as a lightweight rower, that nutrition was very important, because how would I make sure that I'm making the weight that I needed to make, but also maintain my energy level to give 100% for an 8-minute all-out race.
Well, especially for any endurance athlete, but especially for a rower that needs to sustain a specific weight.
I mean, you talk about a cyclist that's on his bike for 8 hours a day. I mean, how much time and energy goes into feeding those athletes, or 4,000 or 5,000 calories? It's a lot.
Sure. This has been awesome. We have to do a part 2. I'm making that very clear. We got to do a part 2 if you're allowed back. So that would be pretty sweet. How do we get in contact with you? How do we get our listeners in touch with you?
You could just find me on LinkedIn right now. Brandon Eck is my name. But you can go there. You can reach out to me with the message through there.
All right. DM Dr. Brandon Eck on LinkedIn. We will have that in the show notes, exact spelling, and a link to that. And that's it, man. This has been cool. Well, you got anything else to add?
This has been a pleasure to be here. Thank you very much for the invitation.
Yeah, round 2 coming soon.
All right.
Thanks for listening to the On Cue Performance Therapy Podcast. If you like this episode, please subscribe on Apple Podcasts and Spotify. It would mean so much to me if you could leave us a 5-star review so more listeners like you could get this important information. See you next time.